You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, thank you so much for taking the time out of your day to join me in the Veterinary Rehabilitation Podcast. Last week I spoke about managing clients' expectations, and this week I'm speaking about managing the catastrophizing client. It was inspired by a lecture by Ansi on our small animal platform. Just by the way, we now have 185 hours of learning on that platform and 390 hours on all the platforms altogether. I really love the advice that Ansi gave to help empower these types of owners to minimize the drain they have on us and our staff, and instead to get them to be a part of the team that rehabilitates their pet. First, a quick word from our sponsors. Choosing the right therapy laser and PMF systems for your practice are big decisions, and that's why our Response system has been helping to make that decision easier for over 35 years by offering both Class 3B and Class 4 lasers, as well as a full line of PMF products designed for both small animals and horses. All their systems are fully rechargeable and adapted for international grids. You can find out more at responsesystems.com. You can also come and chat to Lisa at Response System at the Vet Rehab Summit. This is our online veterinary rehabilitation conference. It's happening on the 12th of November this year. It's actually our 6th year now. Onlinepethealth members, you know about this. You guys get free VIP access. You can register now in the members portal for that. If you're not a member, don't worry. You can still come. You can purchase access for the day, or you can sign up for our free limited access ticket. We want everyone somehow to be a part of this amazing day that we celebrate. If you're a vet nurse, or a vet physio student, you can reach out to us because we also have a student access, and that's especially for you. So it's time for part 2, and this one is on the catastrophizing clients. I want you guys to know that I had to practice that word, catastrophizing, so many times for this podcast. It's not an easy word to say. Hope you enjoy it. So last week I touched on managing client expectations by looking at consistent client experiences, communication, and dealing with talk around money, and also gave you my top tips for dealing with disgruntled clients. So if you have not already listened to that podcast, please go and listen to it, as it really complements today's podcast. So we had this great webinar with Ansi van der Walt, and she talked about managing the expectations of the catastrophizing clients. And today's podcast are some take-home points from that webinar. Many of us enter the field because we want to work with animals more than people, and we only to discover that working with people is a very large part of rehab of every patient. And this is even more relevant when we have a client or caregiver who is facing mental or physical challenges in their lives that can and will impact their perception of their animal's condition. Now, the hard truth is that today most people are facing emotional, physical, and mental challenges, and stress, anxiety, and depression. We have so many people suffering from these conditions. As we consider the rehab journey that the patient needs to embark on over the weeks and months that we treat them, we need to ask ourselves the same question from 3 different perspectives. So Ansi explains we should be saying, what do we think this patient needs? What does the client think the patient needs? And what does the patient think that they need? So there is a good chance that when we come up with these 3 very different answers to those questions, it can lead to expectations being unmet, unsatisfied clients, and unmotivated clients. So in addition, how the client experiences their pet's diagnosis, rehabilitation, and symptoms will ultimately determine their compliance and the outcome for their patient. So in cases where the client has a really strong negative perception about their pet's condition, we need to consider rehabilitation consisting of 50% treating the patient and 50% supporting and educating and empowering the client. Now, Ansi says if we do not consider these 2 individuals, the patient and the client, as 2 parts of the same whole, we may be setting ourselves up for failure. So she explains catastrophizing as the following. Catastrophizing is a cognitive distortion that causes us to look at a set of facts and come to the worst possible conclusion. And this leads to extreme worry or anxiety. Now, there are certain psychological flags that allow us to identify a client that may be prone to catastrophization. And to identify these, we need to remain curious and ask questions of the client throughout the session. And as they answer your question, you need to look for signs of maybe depression or personality disorders. Maybe they've got negative beliefs or judgments around pain or injury. They may believe that any injury will only worsen with time, or that pain will continue to get worse. Emotional responses, maybe such as worry, anxiety, or fear that you might see as you're talking to them. Pain behaviors, coping strategies, or avoidance of activity due to fear of re-injury or causing pain. And they have a tendency to magnify or exaggerate situations or conditions. So a client may also directly share with you their expectation of the worst possible outcome. So remember that you're not here to judge them. You're not there to diagnose or treat your client's mental state or condition, but you do need to support them and you need to uplift them so that they can facilitate the rehabilitation of your patient, the animal, because that's the most important thing. So these clients will often lack compliance, and they usually are the ones that don't do the home exercise programs or treatment plans. They may be afraid that they're going to do something wrong. They might cause more pain or re-injury, and this can be really frustrating for us. These negative perceptions of the home exercise may increase their dependency on us to have in-house rehab, which is great from a business perspective, but it's not really empowering the clients or the patients, and sometimes can lead to our outcomes actually to be worse than they would have if we had a compliant owner. So catastrophization happens when a client tells themselves some negative story about the situation and it doesn't actually match the facts. So the story will focus on the problem and will highlight that no change is possible for the patient. There are many things that help or cause a client to create the story. It might be their individual personality, maybe it's a frame of reference, their perspective, it could be environment or their beliefs. All of these things could play a role. We also may unwittingly contribute to the creation of this negative story in the way we maybe present the diagnostic imaging, for instance, or maybe we use medical jargon, or the possible dependency we create on ourselves and our services. So we need to be aware of not creating systems, practices, and processes that cause our clients to become more and more dependent on us, as this will promote helplessness and will further feed them into this negative narrative. So we really need to impress upon our clients that the role they play in helping to rehabilitate their animals at home can make a huge difference. That we give them the resources and we guide them in order to be able to do this and to help their own pets. Ultimately, with our clients inclined to this catastrophizing, we have a responsibility to help them distinguish between the facts and the story in their minds and help to empower them in their role as the caregiver of their pet. In addition to this helplessness, negative thinker who quickly concludes that all is lost, we may encounter clients who blame and complain, so they become frustrated and aggressive or shift the responsibility for a situation away from themselves. And when this happens, we have a tendency to follow them into the space of blame, which is not healthy for the relationship or for our own mental wellness. So if we're honest, we too can be negative about clients. So how often have we complained about a client or blamed them, even if it's only in our mind, for not sticking to a home exercise program? How often do we place expectations on clients and make assumptions about their abilities? My guess is that you can think of a few clients where you've done exactly this, and there is a good chance the outcome of that rehab program did not go according to plan. So we really need to make conscious and deliberate choices in these situations, and we need to take ownership and responsibility for the situation. So clients, they can be difficult, and we can only change our own assumptions and responses, not theirs. So we need to acknowledge our own prejudices and recognize difficult client situations for what they are. They're usually a combination of poor communication skills, and we touched on this in the previous podcast, and stresses that have nothing to do with us. So check out last week's podcast for my tips on dealing with these disgruntled clients. Once we show a little understanding of the clients, remain open to their needs, we can find a better way to encourage and empower both of them and ourselves. So Ansi shares two different relationship dynamics with us. And the first is the drama triangle, where we can show up in one of three roles. So the rescuer, the victim, or the persecutor. So when a client comes to us, they may view us as the rescuer and themselves as the victim. So over time, or if something does not go according to plan, either one or both might become the persecutor, where blame and accusations are made. So it's very easy to be trapped in this drama triangle. The second relationship dynamic is much more empowering. In this dynamic, we show up as the coach who empowers and encourages our clients to make decisions and changes that their animals need. And when we consciously reject the rescuer role and position ourselves firmly as the coach, our clients no longer respond as victims. Instead, they gradually move into becoming the creator of positive change in their animal's life. So this way, neither party is likely slipping into being the persecutor. Instead, if problems do arise, we can be challengers, helping our clients to overcome the obstacles that they face, be the coach and occasionally the challenger rather than the rescuer, victim, or persecutor. Ansi says in her webinar, all behavior is driven by emotion, which is driven by a need that is usually unmet. So in order to shift both ourselves and our clients into a more positive and constructive mind space, there are a few things we can do. So 1, create a safe space. Ansi recommends starting with an attitude of, I'm okay, you're okay, in our interactions with clients. So be very aware of creating a judgment-free, safe space in your practice and your presence that allows the clients to share their ideas, thoughts, problems, and solutions. And as you listen to and discuss the case with your client, be aware of not making them out to be wrong and overruling them with your expertise or expert opinions. Number 2, create mutual purpose. So you want to create a space where you and your clients are working together to come up with solutions in a therapeutic alliance. Keep an open mind and ask questions as you share your perception of the facts, and ask for their perceptions of the scenario, and ask them what they think the implications of the diagnosis are and how physiotherapy can help or change their animal's life. And encourage as much feedback and participation as you can. The third one is setting goals. So spend time identifying the needs and goals of the patient and the owner, and set outcome measures according to those needs and goals together with the clients. So make sure that the outcome measures are specific and measurable. Successfully rehabilitating a patient needs to include the owner, caregiver, or client in the process, especially if they have a negative perception of the situation and the outcome for the animal. We need to accept that we have a great deal of responsibility in this scenario, and to play an active role in empowering and uplifting our clients without making judgments, shifting blame, or becoming frustrated with their actions. So that way, we coach our clients, no matter how difficult they may be, into becoming key role players in their pet's health. And this makes for better outcomes for our patients and happier working days for us. So we need to identify what type of client we're dealing with, and then find an effective way to communicate with them and guide them to work with us positively for the best outcomes in the end for our patients. So I hope that you've found these 2 podcasts really, really useful. If you're an Online Pet Health member and you haven't watched that webinar by Ansi van der Walt, go and have a look at it, Managing the Expectations of the Catastrophising Clients. I've just touched on a few of the points that Ansi shared, but you will find that really, really useful in dealing with clients. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. For more information about continuing education for vet rehab therapists, you can go to Onlinepethealth.com. I'd like to thank you for listening to this podcast, and of course, thank our sponsors, Response System. They are as passionate about therapy lasers and PEMF equipment as you are about veterinary rehabilitation. They would love to answer any questions you have, so please feel free to reach out to them at responsesystems.com, or you can email lisa@responsesystems.com.